Okay, guys. So going to subject छोटा नहीं है. Okay, starting with question number 1. जो the following is considered as key symptom of depression. रटना नहीं है. रटना नहीं है. Understand? In depression, you will see suicidal ideas. So these are feature of only major depression. अभी आ रही है. Suicidal ideas are feature of major depression. Loss of appetite. It is also seen in major depression. Loss of energy you will see in some form, but low mood is seen in almost all forms. Right? So all form of depression will have low mood. Okay, what is Capgras syndrome? Capgras syndrome. Okay, so this PDF will be shared. You don't have to write anything. The PDF कैसे मिल जाएगा? Just go through this one. So what is delusion? It is false, unshaken belief. It is false, unshaken belief, despite of contrary evidence. इसका मतलब क्या इसको समझो? एक belief है evidence के against में. So how you will differentiate this from superstitiousness? Superstitiousness means andhavishwas. Andhavishwas means this may change. It may change. तो कुछ लोग बिल्ली रास्ता काट जाती है तो आगे नहीं चलते. 20 तारीख को बिल्ली रास्ता काटेगी, आगे जाओगे नहीं जाओगे? Superstitiousness may change. Delusion is unshaken. Unshaken means it is firm. It is a firm belief. So we have different types of delusion. For example, delusion of persecution. क्या होता है? Delusion of persecution means somebody want to harm me. That is somebody want to harm me. Delusion of grandiosity. It is also called as megalomania. Megalomania means it is seen in means alcoholics or in mania. Alcoholics and mania. Delusion of persecution is more in girls. ये मेरे बारे में बात कर रही है. ये लड़का मेरी तरफ देख रहा है. That is delusion of persecution. Then we have delusion of poverty. It is some people, even though they have a lot of money, they think they are poor. Delusion of nihilism. It is also called as Cotard syndrome. Then we have delusion of love. What do we call this? Decoded syndrome. The classical example of decoded syndrome is Rakhi Savan. याद रखना. Then what we have? We have delusion of doubles, right? Capgras syndrome. Capgras syndrome. And we have Decoded syndrome. Capgras syndrome and Decoded syndrome. So both are delusion of doubles. Means in Capgras syndrome, a familial person is replaced by imposter or stranger. कोई family person किससे replace हो गया? Imposter. In Decoded syndrome, imposter seems to be familiar. Imposter seems to be familiar. Both are delusion of doubles. So these 6 and 7, these are delusion of doubles. एक और होता है delusion. That is like जिसमें ज़्यादा शक करते हैं. What do we call that? क्या बोलते हैं उसको बताओ? Othello syndrome. Othello syndrome, understand, is something where person doubt a lot about his or her partner. It is more in males. Illusion of love is more in females. ये सारे illusion हो गए. So these are the important illusions that they ask in exam. Now understand, Capgras syndrome is mostly seen in which type of dementia? So vascular dementia is seen after stroke. तो इसमें नहीं होता है. Frontotemporal dementia will be having association of epilepsy. इसमें epilepsy होगा, gustatory hallucination होगी. Now we have two diseases which have association with Capgras syndrome, Alzheimer as well as dementia with Lewy body. Out of this, dementia with Lewy body will have 35% more chance. So both A and B are correct, but B is more correct. तो आंसर क्या होगा? Dementia with Lewy body. Okay, following are feature of pseudo hallucination. They occur without stimulus. Yes. अब देखो क्वेश्चन के पीछे एक्सेप्ट है. They are perceived in objective space. No, these are subjective. All hallucinations, whether they are pseudo or true, they are vivid and they are not controlled. This is for both. Understand? In psychiatry, whenever we see a clinical case, sometimes you have to make a diagnosis based on duration of disease and sometimes based on symptom. The female patient present 5 days after delivery with symptom of sadness of mood, irritability, restlessness, and reduced sleep. Now here two things are important. First is symptoms are mild, mood sadden, irritable, restless, and reduced sleep. Then you can see this duration is very, very important. So immediately, like within 2 weeks, if something is occurring in female after pregnancy, that is what we call postpartum blues. If this go beyond a week and patient develop major sort of depression, we call this postpartum depression. And if it progress, patient develop hallucination, that is called postpartum psychosis. Okay? So these are 3 postpartum conditions. So why it is blues? First, symptoms are mild, then it is onset is 5 days. तो आपको क्वेश्चन में हिंट देंगे. Try to answer. बताओ क्या होगा? Patient is showing stubbornness and frugality as per sexual stages of development. Fixation and which stage? So this is like a topic which I am saying it is missing from your notes. So we have certain psychosexual stages: oral phase, anal phase. Then what we have? Phallic phase, latent phase. Oral phase, anal phase, phallic phase, then we have latent phase. These are psychosexual phases. Remember the mnemonic O, A, T, L. Understand what I mean by oral phase? उसको समझो पहले. Just imagine a baby who is newly born. तो छोटा बच्चा होगा तो for first 2 years, शुरू के 2 साल, if you see, he will take anything in mouth. अगर आप उसको कोई टॉय दोगे उसका मुंह खुल जाएगा. So that phase is called oral phase. In 2 to 5 years, 2 से 5 साल का बच्चा होगा. This baby is learning where to urinate, where to defecate. उसको पता होता है कि अब वॉशरूम में जाना है तो वहां सुसु करने हैं, फिर हाथ धोने हैं. He is learning this. Then we have a phallic phase. In phallic phase, what we see? In phallic phase, you will see 2 complex. One is called Oedipus complex. The second is called Electra complex. Electra. Now understand? Oedipus complex means if you see a baby, अगर boy child होगा, this will be attracted towards mother. And if it's a girl child, she will be attracted towards father. फिर एक phase होगी जिसको हम बोलते हैं school going phase. School going phase. In the school going phase, you will see like there is an attraction towards same sex. Means girls will like to play with girls, boys will play with boys, and they have I can say a sense of quarrel between each other. लड़कियां लंगड़ी खेलती हैं, boys कंचे खेलते हैं. लड़कियां बोलेंगी girls are best, boys are saying boys are best. Then after this, there will be a phase that will go till death. And that phase is called genital phase. So genital phase is actually a relapse of phallic phase. So phallic phase में क्या था? Boy is attracted toward mother, girls attracted towards father, means attraction towards opposite sex. So genital phase means this will come around puberty, and in this phase you will see attraction towards opposite sex. Attraction towards opposite sex. तो इस स्टेज में क्या होता है? मेरे बाबू ने खाना खाया. So that phase is called genital phase. Now try to understand what Freud tried to correlate these stages. Oral phase. Suppose if this oral phase is prolonged or fixed. If oral phase is prolonged or fixed. Oral phase में बच्चा क्या कर रहा है हर चीज को? So if this phase is prolonged, then patient will become alcohol addict. So he will later on also drink alcohol from now. So in alcohol addiction, what is the phase that is prolonged? Oral phase. In anal phase, people are learning where to urinate, where to defecate. So a sense of reality, what is wrong, what is right. तो उसको हम बोलते हैं sense of self recognition. That is called frugality. तो पता चलता है क्या सही है क्या गलत है. कब हाथ धोते हैं, हाथ कौन धोता है? OCD. For diseases which are fixed due to prolongation of anal phase, that will be frugality and OCD. Phallic phase is seen sometime. कभी कभी आप देखते हो like real mother and son, they are having affair. So that is a rare kind of thing. Then latent phase, sometime if this is fixed or this is prolonged, then you can see girls will be continuously loving girls. That means they can become lesbian and boys can become gay. Similarly, if latent phase is prolonged, then some boys will have excessive sexual desire. That is called satyriasis. And some girls will have excessive sexual desire. We call this hypomania. Clear? So now you will see questions related to this. Patient is showing stubbornness and frugality. As per psychosexual stage of development, fixation is in which phase? Anal phase. But these are all MCQs. ये भी पीछे एग्जाम की क्वेश्चन है आपको पढ़ने. Fixation of these other things are also important. So Electra Oedipus ये कई बार एग्जाम में पूछते हैं. Electra and Oedipus. Okay, next is easy one. Trichomoniasis किसमें होगा? In kleptomania. Sometimes it is seen in kleptomaniac patient. What? Kleptomania? Trichotillomania. Trichotillomania. Okay, try to answer. A 27-year-old patient is presented with complaint that aliens are communicating with him. They are sending an electromagnetic radiation to his brain and are asking him to kill distant relatives. His relative said he has been suffering from disease for the last 20 years. Now see the timeline. In psychiatry, timeline is very important. Patient does not work on farm and stop doing his social function. Patient is aware of time, place and person. What is the most likely diagnosis? तो कोई डिप्रेशन के सिम्टम लग रहे हैं? Do you see any delusion features? What do you think? Now see first thing. Aliens are communicating. It means aliens are communicating means it is thought insertion. Right? Some voice ego. They are sending electromagnetic radiation and asking him to kill distant relative. So we call this somatic passivity. Ultimately, these are features of schizophrenia. Mental state examination asked to subtract 7 from 100. So answer should be calculation. Answer should be simple mathematical calculation. So simple mathematical calculation वो option में नहीं है. So it's basic mathematical calculation. This you can extract from your concentration ability. Right? Basic maths function. So it is not orientation, memory or confusion. What is most common effect of cannabis or marijuana intake? ये तो वो बताएंगे जो कल लेकर आए हैं। तो after cannabis, you get anxiety? No. You get even more happiness. Do you get depression? No. It do not present any. It do not cause any kind of physical dependence. The answer is a state of dreaminess with altered consciousness. So even you can see sometime elated mood. Mood अच्छा रहेगा. A patient presents with sudden and irresistible urge to take an action. Sudden and irresistible urge is called impulse. So what are various impulse disorder? So we have kleptomania. Kleptomania means it is impulsive desire to steal things. चोरी करेगा ऐसी चीजों की जिसकी कोई वैल्यू नहीं होगी. Then we have trichotillomania. Trichotillomania means impulsive hair pulling. What else? Oniomania. Impulsive shopping. यहाँ पर आंसर नहीं है तो मैं लिख दे रहा हूँ शॉपिंग. Pyromania. Impulse of setting fire. बार बार बातचीत से आग लगा. Pyromania. So these are then what we have. We have impulse gambling. Impulse gambling means कुछ लोगों को जुए की आदत पड़ जाती है पत्ते खेलते हैं. What else is impulse disorder? Impulse Instagram. जो कुछ लोग रील्स देखते हैं. So that internet use is also a type of impulsive disorder. Last is impulsive sex. So these are example of impulse disorder. In video game भी internet का part है, तो video game is also part of impulsive disorder. Okay, next one. A 21-year-old girl suspect that college principal is making a conspiracy against her. देखो लड़की दिया क्वेश्चन में. She is planning to fail her upcoming exam. She feels that other teachers have also joined the conspiracy and students are helping them too. Othello syndrome is illusion of Othello. Infidelity or jealousy. The answer is fascination. Am I clear? Okay. 37-year-old man report that after suffering from sudden financial loss. So this sudden financial loss is the trigger. Trigger है. He developed certain symptoms. He started feeling fearful that someone is about to harm him. ठीक है? Delusion of persecution. He could not sleep or eat properly. These are features of depression. He also began to hear voice of a female, and that voice would abuse him and say that he was useless and should kill himself. It means suicidal ideation. This symptom stopped approximately after 1 week. Now understand, if it could have persisted, then it could be a case of schizophrenia. But ये बंद हो गए symptom. There was no relevant past history of drug abuse. Now two hints, understand this question. There are two hints. First is trigger is present. Then symptoms stopped after 1 week. So that is why it is not a case of schizophrenia, schizoaffective or prednisone disorder. It is brain psychotic disorder. Delusion is a disorder of false, unshaken belief. So it's a disorder of thought process or thinking. Female was brought to psychiatry after 3 weeks of delivery. Fearfulness, irritability, and getting suicidal thought. Now understand, this is again, you need to see the history. Okay, होगा? Is it schizophrenia? No. Is it psychosis? No. Now you are left with two choices. Blues or depression? High depression? Suicidal thoughts. Suicidal thoughts are present. Next. A 24-year-old lady. देखो आधे क्वेश्चन तो फीमेल की आ रहा है. 24-year-old lady presented sudden onset chest pain, like heart attack, palpitation, lasting for about 20 minutes. Panic attack. There has been previous recurrent episode for same. She says there was 3 similar episodes last month. तो मुझे बताओ what are the DDs, differential diagnosis in this case. 24 साल की लड़की को MI. MI is not a DD. What is a DD? DD will be एक तो panic attack. Panic attack is also called as anxiety neurosis. Panic attack का दूसरा नाम होता है anxiety neurosis. What else? और क्या हो सकता है? और क्या हो सकता है? It could be GERD. Most common cause of chest pain is GERD हो सकता है सिर्फ. What else? और क्या हो सकता है? अरे MI नहीं है ना, 24 साल की लड़की को MI नहीं होता. Which type of arrhythmia?
PSVT.
It could be PSVT. Paroxysmal supraventricular tachycardia. Right? Now see, ये तो ऑप्शन में नहीं है. So can it be mania? No. PTSD में कोई ट्रॉमा की हिस्ट्री नहीं है. Acute psychosis में तो आंसर है panic attack. लेकिन आपके दिमाग में जो क्वेश्चन पढ़ रहे हो तो DDs बन जाने चाहिए. हर चेस्ट पेन MI नहीं होता. Is it clear? Okay, management of violent patient in psychiatry is treated with all except. Now see, question is telling you the hate violent. Violent means patient खुकार है. जब पेशेंट खुकार है तो उसको बैठ के नहीं समझाओगे. When patient is violent, you have to sedate him. तो benzodiazepine आप दोगे. Electric convulsive therapy और electric shock therapy आप दोगे. Haloperidol is also a sedative. तो वो भी आप दोगे. तो बैठ के नहीं समझाओगे. बैठ के समझाने क्या बोलते हैं? Cognitive behavioral therapy. So what are the variants of CBT? CBT के कुछ types होते हैं. So first type I am writing here squeeze technique. Squeeze technique. Sensate focus. Sensate focus method. Stop and go. So these are three variants of CBT. अभी बता रहा हूँ. Then we have flooding. Flooding. Graded exposure. Graded exposure. Systematic desensitization. Desensitization. Systematic desensitization. Exposure and response prevention. Exposure and response prevention. Modeling. So these are a few variants of behavioral therapy. अब इसको देखो एक बार समझो. Squeeze technique is a couple therapy. So where a female partner is advised, like whenever male is about to ejaculate, she should squeeze the head of penis with her hand. जिससे क्या होगा? Ejaculation delay हो जाएगी. Sensate focus means whenever you are thinking like you are about to ejaculate, you should divert your thought. आप उस टाइम पर कुछ और सोचने लग जाओ. कुछ और सोचने लग जाओ कि मेरे अकाउंट में कितने पैसे हैं. That is means diverting the focus. Stop and go means whenever you are about to ejaculate, you should stop, take your penis out, then again go. Stop and go. So these three techniques are used for premature ejaculation. Exam में question आए. Understand? Flooding, graded exposure, systematic desensitization. These three methods are used for phobia. अब इन तीनों में डिफरेंस क्या होता है? सपोज किसी को हाइट से डर है. somebody is afraid of height और छिपकली से डर लगता है. किसी को लगता है छिपकली से डर? अगर किसी को कोई फोबिया है तो सपोज छिपकली से डर लगता है तो पहले क्या करोगे? पहले पेशेंट को बोलोगे कि इमेजिन करो एक छिपकली. इमेजिनेशन. फिर आप एक आर्टिफिशियल छिपकली लाके दे दो. Artificial. First is imagination. Imagination, then artificial. उसके बाद आप रियल छिपकली निकालते हैं. स्टेप वाइज. पहले विजिट में इमेजिन करो, आर्टिफिशियल, रियल. इमेजिनेशन हटा दो. Only artificial and real. That will become red exposure. Flooding means सीधे छिपकली लाकर छोड़ दो. तो किसी को हाइट से डर लगता है, ऊपर से टांग दो. That is called flooding. Flooding means immediately expose the patient to sub-threshold stimuli. So these three methods are used for phobia. समझा? What do you think? What is best? What is best? Systemic desensitization. अब ऐसा साइकियाट्रिस्ट करते हैं तो लोग बोलते हैं पैसे बना रहे हैं. But this is the best method, systematic desensitization. Exposure and response prevention means it is used to treat OCD. तो पेशेंट को सपोज डर्ट से डर लगता है, गंदगी से, पहले कूड़ा फेंक दो. उसके बाद जब वो हाथ धोने जाए तो जाने मत दो. तो first expose the patient, then prevent the response. Modeling understand this, we tell the patient to think about or to make a role model. फिर उसको बोलो कि उसके नक्शे कदम पर चले. For example, many people idolize Mahendra Singh Dhoni. So that is a role model. तो ये किस में यूज होता है? नशेड़ियों में. In addiction. So you have to make a role model and follow this path. This is for basically for de-addiction, नशा मुक्त करने के लिए. So these are variants of behavioral therapy. समझ गए? Okay, आगे चलते हैं. Negative symptoms are all except. बताओ. Anhedonia. Anhedonia means loss of desire in pleasurable activities. Apathy, alogia. These are negative symptoms. Overactivity is a positive symptom for mania. Kapgras, Prigoli. Easy one. Familiar person replaced by imposter. ये क्या है? This is Prigoli. Why is cheating with another man? Othello. This one famous person in love with patient. D. Clarenford. D. Clarenford. So Prigoli is non-familiar, appears to be familiar. Clear? Most weight gain. अगर ये ऑप्शन में नहीं है तो ये हो जाती है. So these are the drugs which are associated with most weight gain. Following is seen in catatonia. Understand? Catatonic is a type of personality. Catatonia is also a type of schizophrenia. Understand? Here you will see features like person will try to repeat whatever you say. आप कुछ बोलोगे उसको repeat करते रहेगा. आपने पूछा what is your name, वो बोलेगा what is your name. That is echolemia. Right? Understand? Disobedience you can see, but that is more suggestive of ADHD. पॉजिटिविज्म नहीं मिलता, नेगेटिविज्म मिलता. कैटाप्लेक्सी से कुछ लोग कंफ्यूज हैं. यहाँ पर कैटालेप्सी मिलता है, कैटाप्लेक्सी नहीं. राइट? इन कैटाटोनिया यू विल सी कैटालेप्सी. कैटाप्लेक्सी इज सीन इन नार्कोलेप्सी. नार्कोलेप्सी मींस एक्सेसिव डे टाइम स्लीपीनेस. ओके, बताओ. Old patient was brought to hospital with history of auditory hallucination. Auditory hallucination. He stated that some unknown people are conspiring against him. He hears them talking on his every action continuously. What will be the most likely diagnosis? बताओ क्या होगा? Is it dementia? No. What do you think? It is acute psychosis? No. Acute psychosis में आपको time frame चाहिए. Time frame mention नहीं. Auditory hallucination and delusions both are together. So it is not a single delusion. Hallucination कितना? So again it's a case of schizophrenia. बताओ. Patient is brought to a clinic with complaint of unrealistic behavior from past 5 to 6 months. Family members mention about loss of his wife few years back. They also mention about his talking behavior in absence of everyone and sometimes muttering to himself loudly inside his room. क्या होगा? The patient is brought to a clinic with complaint of unrealistic behavior from past 5-6 months. So एक option rule out हो गया. Family member mention about loss of his wife. Wife की death हुई है. That is a trigger. They also mention about his talking behavior in absence of everyone. कोई भी नहीं फिर भी बात कर रहा है. And sometimes muttering to himself. So, do you think depressive patient they mutter themselves? The answer is not depression. Then what do you think? क्या हो सकता है? There is chronic duration, so that's why diagnosis will be schizophrenia. Schizophrenia patient refuses to take drug because he complained that he is persistently hearing people talking in spite of taking medication. Which drug most suitable for this condition? So in simple language, they are asking you. दवाई देने के बाद भी स्किज़ोफ्रेनिया ठीक नहीं हो रहा तो उसको बोलेंगे रिफ्रैक्टरी और रेजिस्टेंट. तो रेजिस्टेंट स्किज़ोफ्रेनिया में क्या करोगे? और क्लोज़ापिन के बाद भी ठीक नहीं हुआ तो इसके बाद भी ठीक नहीं हुआ तो इलेक्ट्रोकन्वल्सिव थेरेपी. इसके बाद भी ठीक नहीं हुआ तो ECT. 43-year-old male is diagnosed with schizophrenia but he refused to take treatment. दवाई नहीं ले रहे तो आप क्या करोगे? आप ऐसी दवाई लोगे जिसका डिपो प्रिपरेशन आते हैं. तो बेसिकली दीज आर इंट्रामस्कुलर ड्रग्स जो बॉडी में रिलीज हो जाएगा और डेली एक हफ्ते तक वो अपनी दवाई निकालते रहेगा. So you don't have to take daily tablets. So that drug is flufenazine. It's available in depot form. Clozapine, olanzapine, desperadone की tablet आती है और इसका इंट्रामस्कुलर डिपो प्रिपरेशन आता है. So these all are tablet. Clinical manifestation of schizophrenia are all except delusion होता है. Catatonia होता है. Catatonia is also a type of schizophrenia. Even most common type of schizophrenia is catatonia. Auditory hallucination होते हैं. Altered sensorium is a feature of delirium. It's a feature of delirium. Clear? इसको बोलते हैं sundowning phenomenon or subjective phenomenon. Following is not a characteristic symptom of schizophrenia. Inappropriate affect. Okay, let's talk about affect. Affect means this will depend solely on your mood. So we have different type of affect. So first we call it normal affect. Normal affect means आपके FMGE एग्जाम में 250 नंबर आ गए, you are happy. That is normal affect. Second type of affect is called blunt affect. Blunt affect means 250 नंबर आ गए, आपको खुश होना था लेकिन उतना खुश नहीं हो. Means decrease intensity. Third is flat affect. Flat affect means 250 नंबर आ गए और चेहरे पर कोई खुशी नहीं. Means no intensity at all. And fourth is called debile affect. 250 नंबर आ गए और रो रहे हो. So debile affect will be opposite. Is it? So these are 4 types of affect. To understand this, these blunt, flat, debile, all these affect you can see in a patient of schizophrenia. So inappropriate affect होता है. Thought process means disturbance of thought means delusion. ये भी होगा. Auditory होते हैं, visual नहीं होते. Visuals are suggestive of alcohol addiction or organic brain disease. Prognosis in schizophrenia is less favorable. तो अगर फीमेल में होगा then you can have a good prognosis. डिप्रेशन की हिस्ट्री होगी, गुड प्रोग्नोसिस जल्दी होगा. अगर late diagnose हो रहा है, gradual onset, that will have a poor prognosis. Okay, now just try to understand. We have different types of schizophrenia. Although this classification is removed from ICD-11. Catatonic, paranoid, apophrenic, simple. Okay, now understand? So in schizophrenia, we have some positive symptom, negative symptom. Positive symptom means जैसे कि delusion, hallucination, thought insertion, broadcast. जितने पॉजिटिव सिम्टम होंगे उतने जल्दी आप डिसीज को डायग्नोस करोगे, उतना जल्दी ठीक करोगे. नेगेटिव सिम्टम मींस दे विल मास्क द मेन सिम्टम. तो मेन सिम्टम छुप जाएंगे, तो डायग्नोस लेट होगा, तो ट्रीटमेंट लेट होगा. सो कैटाटोनिक will have all positive symptoms. Paranoid will have mostly positive symptoms. Epiphrenic will have mostly negative symptoms. And simple will have all negative symptoms. अब मुझे देख के बताओ, which type you can diagnose early? Which type will have best prognosis? And which type will have worst prognosis? तो याद रखना, simple is not simple. Worst prognosis. But most common type in practice is paranoid. Most common type will be paranoid. So more the positive symptom, more early you can diagnose, more early you can treat. So best prognosis बताओ. क्या करें? A college student was caught up by police for fighting with classmates because he thought they were planning to kill him. He stated that his dead grandfather talks to him every now and then for last 1 month. He is delusional from past few weeks also. What is most likely diagnosis? बताओ क्या है? College student was caught by police for fighting with classmates because he thought they were planning to kill him. He stated that his dead grandfather talks to him every now and then for last 1 month, which takes many children. So do you think he's having any delusion? No. Right? Then do you think it could be a case of schizophrenia? It could be mania. So what is the trigger? Trigger is just the case of PTSD. A 13-year-old boy is brought by the parents with history of frequent fighting at school. Understand this? एक मूवी देखी, उसमें इमरान हाशमी छोटा बच्चा होता है. लड़की का स्किज़ोफ्रेनिया दिया हुआ है. क्या दिया हुआ है? क्या कह रहे हो? College student brought by police for fighting with classmates because he thought they were planning to kill him. He stated that dead grandfather talks to him. Delusional from past few weeks. Few weeks का है, तो that week history is not sufficient to make a diagnosis of schizophrenia. Okay, इसको बताओ. इसका क्या होगा? Frequent fighting at school, disciplinary problems, stealing money, assaulting his classmate, and being weak in study. Understand? Autism prefer to be silent. ADHD, they prefer to be hyperactive. But there will be not any social violence activity in them. So it's a case of conduct disorder. इसको differentiate करोगे कैसे? Understand this? How we can differentiate this? Frequent fighting at school, disciplinary problem. These are also seen. These are also seen in ADHD. Stealing money, assaulting batchmate, right? Being weak also you can see in ADHD. So more I can say violent behavior will be feature of conduct disorder. Bleuler. Okay, schizophrenia we have some scientists. So understand this, we have a scientist called Kraepelin. Kraepelin ने क्या किया था? Kraepelin Bueller, Schneider, Schneider, Carletti and Binney. Kaplan में क्या क्या? He gave a term dementia precox. Schizophrenia को क्या बोला था इन्होंने? Dementia precox. Bueller gave 4 A's. 4 A's. Schneider gave first rank symptom. First rank symptom means अगर ये symptom है, then you can easily make a diagnosis of schizophrenia. Carletti and Binney, they have discovered ECT, electroconvulsive therapy. Not right answer. Not 4 A's of Bueller. Association होता है, inappropriate effect होता है. Effect कैसा होगा? या तो flat होगा या blunt होगा. Ambivalence होगा.
Yes, sir.
What is ambivalence? होता क्या है? What is ambivalence? It is when you can't decide कि आपको किसी के साथ में चलना है, against the thing or for the thing. So आप when you can't make a decision, confused, that is called ambivalence. Automatism is not a part. बताओ first rank symptom. Schneider ने दिए थे, क्या होगा? Understand, in first rank symptom you will see patient will have delusion, but that will not be like delusion of persecution. You can see there will be hallucination. Then you can see some thought defect. Thought defect. So running commentary means it is called hallucination. It's a type of auditory hallucination. Thought insertion. Primary delusion, but there is no delusion of guilt. इसमें guilt नहीं होगा. कैसा delusion होगा? Delusion of persecution. बताओ. Antipsychotic drugs relieve positive symptoms by targeting which of the following neurotransmitter. बताओ. Dopamine or serotonin?
Dopamine.
Okay, so let us discuss all the neurotransmitter in Alzheimer's disease. Schizophrenia, depression, Parkinson disease. Alzheimer में कौन सा neurotransmitter effect होता है बताओ? Decrease acetylcholine and increase glutamate. Schizophrenia, DNS increase, and in depression, DNS decrease. DNS means dopamine, norepinephrine, serotonin. Schizophrenia में बढ़ जाएगा, depression में कम हो जाएगा. Parkinson disease, dopamine decrease. What is increased? Acetylcholine increase. Understand? Antipsychotic drugs relieve positive symptom of schizophrenia. तो schizophrenia में क्या क्या होते हैं? DNS, GABA is ruled out, acetylcholine is ruled out. So जितने भी antipsychotic drugs, how they target positive symptom? By these two, dopamine और serotonin. Antipsychotic drugs कैसे काम करते हैं? So they target either dopamine or serotonin, but you have to choose one answer. दोनों answer से even if I say one more option, norepinephrine is also correct. जो हमारे ड्रग होते हैं, they mainly act on dopamine or serotonin or norepinephrine. So antipsychotic drug purpose is to decrease dopamine, decrease serotonin, and decrease norepinephrine. But how you will get rid of positive symptom? कैसे काम करोगे? बताओ क्या आंसर होगा? C, D, E. Again, answer is D. D is better answer than serotonin. A कैसे होगा? बताओ. All are first rank symptom of schizophrenia. Voice commenting, throat broadcasting, delusion of persecution, somatic passivity. क्या होगा बताओ? Voice commenting means it is. Voice commenting क्या होगा? Thought broadcasting. So voice commenting, thought broadcasting. देखो thought insertion thought broadcast. This will be positive symptom and first line symptom. Somatic positivity is also first line symptom. Voice commenting or delusion of persecution. Again, it's a question which is wrongly framed. So delusion of persecution होता है, होता है. Voice commenting is also actually में चारों answer first line symptom है. All are first line symptom. Voice commenting is also a type of auditory hallucination. Somebody is commenting or commanding. अब आपको इसमें choose करना है तो what you will choose? So उसमें I think any one option you can choose, but actually all these are first line symptom. चारों ये first line symptom है. क्या क्या होता है first line symptom? तीन thought के होते हैं, thought insertion, thought broadcast, thought echo. Then we have delusion, delusion of persecution. Then we have hallucination, which could be commenting type or commanding type. कोई order दे रहा है या कोई comment कर रहा है. What else? Somatic passivity. 4A's बताओ. Ambivalence होता है.
Yes.
Affect. Autism होता है. होता है. Auditory hallucination are not part of 4A. Not a negative symptom in schizophrenia. बताओ. Anhedonia means depression, decreased emotional expression. Delusion is a positive symptom. तो positive symptom में एक बार यहाँ पर लिख देना. What are positive symptom? Hallucination, delusion, then remember thought, and somatic passivity. Somatic passivity. These are positive symptoms. Prognosis is less favorable. ये तो repeat हो गया. If gradual onset, right? So repeat question. Cancer syndrome was first identified in people living in jail, in prisoners. So what they do, they will prefer to give one-liner answer. ये आपको एक लाइन में आंसर दे देते हैं. That is means they will give approximate answer. So cancer syndrome, it is seen in those जिनको जैसे 7-8 साल की सजा जेल में है. So it was reported in those. Approximate answer. Delusion is a disorder of thought. Okay, now try to answer. पहले बताओ है कि a child with schizophrenia was on medication. Schizophrenia था, medication ली, suddenly developed neck stiffness and spasm. क्या है ये? Dystonia है. So once you know the diagnosis, then things will become simple. If it's a case of dystonia, what drug you will give? You will give benzodiazepine. Diphenhydramine is antihistamine, lorazepam is sedative, propranolol. तो पेशेंट को डिस्टोनिया हो रहा है तो क्या देते हैं इसके अंदर? बेंजोडाइजिन. इजी वन. क्या होगा? Identical looking individual has been replaced by imposter. So this is Capgras. Capgras. Wheels technique. Three major ejaculation. Okay. Okay. Next is a patient had COVID infection around 3 months back. Now he presents with complaint of excessive sweating, palpitation, and fear that he is about to die. Physical examination investigating didn't reveal any abnormality. What is the likely diagnosis? Now see. Okay, so it is not a case of depression because depression में palpitation नहीं होगा. It's not a case of mania. Now you can see excessive sweating, palpitation. Excessive sweating is generally not seen in PTSD. So answer will become panic attack. Okay, बताओ. Following is not a symptom of panic attack. किसी को हुआ panic attack कभी? So panic attack, how you will manage? कैसे ठीक करते हैं इसको? How you will manage panic attack? So panic attack में anxiety होती है, episodic anxiety होती है, मौत से डर लगता है, सुसाइड करने का मन नहीं होता, right? There is sense of impending doom. 32-year-old female present with symptom of mild depression for first time. पहली बार हुआ है, वो भी क्या? Mild depression. क्या करोगे? Electroconvulsive therapy is given for depression with suicidal ideas. CBT with antidepressant again in severe depression. तो उसमें आप सिर्फ बातें करोगे. बातें करने को बोलते हैं साइकेट्री में cognitive behavioral therapy. Yeah? Mild depression में क्या करोगे? बातें करोगे. Okay, next one. 31-year-old female with history of recent divorce. Present to emergency with complaint of palpitation, sweating, heaviness, pain in chest. Panic attack लग रहा है अभी तक? She has multiple similar episodes in last few weeks and is not able to sleep properly for past few days. Blood investigation ECG are normal. So what is the diagnosis again? It is panic attack. क्या करोगे panic attack में? Right? It is a case of panic attack. What you will give? Tranquilizer. 25-year-old male had RTA, road traffic accident. After that, he is fearful of driving vehicle and went to that place since 6 weeks. Since 6 weeks and is having flashback of incident and is not going to his office also. तो देखो ये पैनिक डिसऑर्डर तो नहीं है, ये डिप्रेशन नहीं है, ये स्ट्रेस भी नहीं है, it is PTS. So what is the trigger? A person is unable to find pleasure in doing old activities. What is called? क्या बोलेंगे इसको? Anhedonia. Loss of desire in pleasurable activities. Anhedonia. A clinician asked the patient, "How is your mood?" Patient replied, "Up and down." So neologism means he will add some new word. So अब इससे पूछा कुछ और है, and he is answering something else. So what do we call this? Tangential. Okay, now understand. Suppose if I make a mood graph. In this mood graph, try to understand. Suppose इसके लाइन के जो ऊपर होगा that will be elated mood. इस लाइन के नीचे होगा that will be depressed mood. Suppose if you see a persistent low mood, one possibility. Now try to understand. Suppose you can see a persistent high mood. Sometimes you can see the patient is having low mood. उसको क्या बोलेंगे? Depression. And if there is a persistent high mood, उसको क्या बोलेंगे? Mania. And if you see mania, depression, we call this BPD. And if BPD is more than 4 cycles in calendar year, अगर एक साल में 4 से ज्यादा साइकिल है तो उसको बोलते हैं रैपिड साइक्लर्स. My question is, what we call this? It is a low, it's a high grade of mania. High grade mania को क्या बोलते हैं? Hypomania. And this is low mood. Low mood है लेकिन उतना भी नहीं. Right? Sometimes what happens, there is a low mood. Low mood है. Suppose I can give example like a patient you are having, इसकी वाइफ की डेथ हो गई, तो पहले से मूड लो है, थोड़ा टाइम बाद बच्चे की भी डेथ हो गई, so that will be called double depression. Means depression on already depressed patient. We call this double depression. Okay? तो ये क्वेश्चन पूछते एग्जाम में, तो let us see what is double depression. Major depressive disorder from 2 years. Major depression with OCD. Dysthymia means low grade depression. Low grade depression पे अगर depression हो गया, what we call? We call this double depression. Okay? Indoor management of anorexia nervosa is done in priority. Anorexia nervosa is a disorder where person will not eat. ये पेशेंट खाना नहीं खाएगी, जब ये खाना नहीं खाएगी तो क्या होगा? Weight loss, so you will see cachexia, and she will have self-induced vomiting. Self-induced vomiting, तो हाथ पे साइन बन जाएगा. That sign is called Russell sign. उनकी बॉडी पे हेयर्स होंगे, छोटे बच्चों के जैसे हेयर होते हैं, ग्लैंड्यूलो हेयर्स. एंड वेरी वेरी इंपॉर्टेंट, ये क्वेश्चन बार बार पूछते हैं. What is the menstrual abnormality you will see here? Amenorrhea. और ऑप्शन में मेनोरेजिया आता है. रसल साइन क्यों बनेगा? जब आप वोमिटिंग करोगे तो आप इंसाइजर टीथ हमारे शार्प होते हैं. they will touch where? They will touch the fingertip. अगर आप रोज करोगे ऐसे तो यहाँ पर निशान परमानेंट बन जाएगा, because daily your incisor teeth are touching. That sign is called Russell sign. So simple question is asking you indoor management in anorexia nervosa is done in priority. Priority में किसको करना है? कौन सा डिस्टिंक्ट प्रायोरिटी में किसको करना है? जिसको डिप्रेशन हो, जिसको इम्यूनोरिया will see most patient. अगर 75% से ज्यादा weight loss हो, if you see weight loss more than 75%, that is the first priority. You have to immediately treat the patient. Copycat suicide, इसने करी है तो मैं भी करूँगी. It is more in adolescent. It is more in adolescent. So in suicide, remember, male commit more and female attempt more. Female attempt more suicide, male commit more suicide. So female attempt ज़्यादा करती. This suicide is called para-suicide. इस suicide को बोलते हैं para-suicide. And what male commit is called complete suicide. देखो, मेल बोलेगा नहीं, वो सीधे 5 फ्लोर से कूद जाएगा. फीमेल बोलेगी मैं कूद कूदेगी सीढ़ियों से. Female attempt more, male commit more. Now what are the risk factor for suicide? Suicide के risk factor क्या है? Old age. What else? Depression. What else? Poverty. और बताओ. Males. What else? Stress. Anxiety, stress हो गया. Previous attempt. Single. Separated. Widowed. Divorce. तो इन सबका मतलब सेम होता है. सिंगल, सेपरेटेड मीन्स सिंगल, विदाउट मीन्स लीगली सिंगल, और अनफॉर्चुनेटली सिंगल, डाइवोर्स मीन्स लीगली सिंगल. ये सारे सिंगल केस नॉर्मल से. But most important is previous attempt. Most important will be previous attempt. Okay? Okay, सबसे ज़्यादा सुसाइड कहाँ होती है? सबसे सुसाइड कहाँ होती है? Second will be ऐसा और क्या होता है? China is ahead of India where? Population में तो हम जीत गए. Where else? In nasopharyngeal carcinoma, it is also more prevalent in China. ENT खत्म हुई ना अभी? Okay, try to answer next one. What would be choice of initial treatment when a 65-year-old man with carotid artery stenosis develops severe depression and hypersomnia? Carotid artery stenosis. Now understand, whenever a patient develops carotid artery stenosis, then TCAs are contraindicated. Try psychic antidepressant आप नहीं दोगे, then what we prefer to give मिलना से प्राप्त, this is SNR. क्या दोगे? मिलना से प्राप्त. TCS are contraindicated. Most common psychiatric disorder associated with stroke, depression. Most common will be depression. What is this kind here? Bipolar, no. Major, no. Minor, no. It is persistent. Persistent low-grade depression is called dysthymia. What is true? मैंने बताया था डिप्रेशन में क्या होगा? इंक्रीज तो कुछ भी नहीं होगा. इंक्रीज तो नहीं होगा. DNS कम होगा. Now you have to choose one. हमने क्या लिखा था? DNS. So depressed patient will have mainly deficiency of norepinephrine and serotonin. So answer will be D. दोनों कम होंगे. Answer will be C. Decrease serotonin and norepinephrine. Both will decrease. Okay? बताओ. Same question है. घुमा के पूछिए. Same answer होगा. Serotonin and norepinephrine. Serotonin and norepinephrine. All of the following are feature of masked depression. Masked depression means hidden depression. Sometimes in hidden depression you will see patient will have some somatic symptoms like उसकी body में pain होगा, कमर दर्द, बदन दर्द, abdominal pain होगा, diarrhea, vomiting होगी. Depressed mood is not a feature of masked depression. It's a feature of true depression. अगर depressed mood होगा तो masked feature नहीं होगा. इसलिए answer will be D. Masked depression means जो depression को mask कर रहे हैं. अगर डिप्रेशन होगा तो वो सिम्टम को और दिखा रहे हैं. इसलिए डाली क्या होता है? Disability adjusted life year. So suppose a person who is having whose age is 40 years, 40 साल तक उसको कोई बीमारी नहीं थी. उसके बाद 40 साल के बाद अगले 20 साल उसको डायबिटीज, let us suppose. Right? So this 40 years और 60 साल में उसकी डेथ हो गई. समझ आया? So what is DALI in this case? Disability adjusted life year. So these 20 years, ये जो 20 साल उसने निकाले हैं वो disability के साथ निकाले हैं. And what is this 40 year? PSM. क्या बोलते हैं उसको? सुनाई? Sullivan index. Disability free. Disability free. Disability adjusted. So 40 साल disability free period, 20 years will be disability adjusted. The most common cause of DALIs in the world is depression. एक एज के बाद सबको थोड़ा बहुत डिप्रेशन हो जाता है. Most common psychiatric illness क्या होगा? Answer should be anxiety disorder. चिंता. Anxiety is not even given the option, so next best option will be depression. Okay, 40-year-old man is diagnosed with terminal ill cancer. He is not able to digest the fact. Cancer हो गया. He previously indulged with his children like playing with his daughter, dropping her at school. But now he is not pleasurable. Means what it is? So whenever you develop anhedonia, that is suggestive of major depression. याद रखना. Anhedonia means आपको क्रिकेट खेलना पसंद है लेकिन आप फिर भी नहीं खेल रहे. He even stopped meeting friends and has difficulty in sleep also. So anhedonia is a feature of major depression. Okay? अब तुम लोग सोच रहे हो हमें भी क्रिकेट खेलना पसंद है फिर भी नहीं खेल रहे. तुम्हारा एग्जाम है, वो डिप्रेशन नहीं. A patient who after getting fired from her job preferred to stay isolated. Anhedonia, lost weight. She also thinks that because of her worklessness she got fired. Hopelessness, worklessness, helplessness, hopelessness, worthlessness, helplessness. क्या बोलते हैं इसको? We call this vague triad of depression. एक vague triad मेडिसिन में होता है. क्या होता है? Cardiac tamponade, raised GBP, hypotension, and muffled diaphragm. This is vague triad of depression. So again, anatomy is given. So this is major depressive disorder. 64. Son of a construction worker died at his workplace. After that, he is neither going out nor eating food properly. His wife consulted a physician and stated that he has been doing this for over 2 months. What is the most likely diagnosis? Is it bipolar? Understand? Now we are left with two important choices. Is it severe depression? And it will so it could be adjustment problem or PTSD. कैसे differentiate करें? Son died at workplace. Workplace में बेटे की death हो गई. After that, he is not going out nor eating food properly. Now again, for here you need to understand time frame. 2 महीने से ऐसा कर रहे हैं, so it could be adjustment problem or PTSD. Understand? If it is more than 3 months, we call this PTSD. Here it is adjustment problem. अगर इसमें क्या होगा? It is a normal phenomena. किसी भी beloved की death होगी, तो कुछ टाइम के लिए आदमी isolate हो जाता है. That is a normal adjustment phenomenon. Again, this is important MCQ. बताओ, is common. अकेले रहने में सुसाइड होता है? Yes. After recovery, there is high chance. After recovery, there is high chance. These chance is seen in early depressive phase and late depressive phase. So answer will be A. Right? चाहे इसमें आंसर दे दिया हुआ, that is wrong. Answer will be A. Most common cause of impotency in male. Psychogenic शिलाजीत से कुछ नहीं होगा. Outside environment seems strange. Outside environment अगर strange दिखा, that is derealization. Most common symptom of psychiatric illness? Anxiety. Right? It is anxiety. Okay, almost the same question. So then question to answer होगा adjustment. Bright light therapy. Bright light therapy is used for. Now see, seasonal depression is more in winters. तो जो लोग के घर में वेंटिलेशन नहीं है, अगर नोटिस करोगे तो ये लोग ज्यादा सोते हैं. खिड़की जिसके घर में नहीं है, धूप नहीं आती तो सोते ज्यादा है. बॉटम लगा के हर घर में यही है. Understand this? Bright light therapy means those people living in cold countries. जो cold countries में रहते हैं उनको depression काफी common है. That depression is due to alteration of your sleep wave cycle. तो bright light therapy means ऐसे में क्या बोलते हैं, तो धूप में खड़ा होने के लिए बोलते हैं, तो धूप से वो ठीक हो जाते हैं. Right? That is seasonal depression, which is more in winters. अगर इससे भी improve नहीं हुआ, अगर suppose करो bright light से improvement नहीं हुआ, then what we give? Then we give melatonin. Melatonin की tablet आती है Miloset नाम से. आजकल काफी ट्रेंडिंग है. Non-addictive, non-sedative, sleep-inducing drug, melatonin. Okay, बताओ क्या होगा? Suicidal tendency लग गई means it is ECD. Clozapine you will use in resistant depression, but not with suicidal tendency. Minimum time frame to diagnose depression with daily manifestation. For depression, 2 weeks. For mania, 1 week. Answer is 2 weeks. Most. So what is most common obsession? Most common compulsion. The most common obsession is getting dirty or contamination, but most common compulsion is checking. A patient in ward is asked what is your name, patient repeat the same sentence. क्या होगा? Equal. Where inside stomach found during surgery, which doctor is required to diagnose this condition? So answer will be what is intensivist? ये क्या होते हैं? जो आईसीयू में काम करते हैं, critical care experts are also called intensivists. Uncontrolled and excessive sexual desire in men. Okay, what is sadism? 50 shades of grey देखिए. That is sadism. Nymphomania in female. Voyeurism. Excessive fear of getting contaminated, repeated washing, repeated checking behavior, excessive doubt. OCD. What is the treatment of choice in OCD? Which CBD? Which CBD? Exposure and response prevention. Exposure and response prevention. Okay. A patient has long-term history about waking up in night and thinking that his family is going to meet with an accident. एक आदमी सो के उठ रहा है, पैनिक अटैक की कोई सिम्टम नहीं है, कोई ओसीडी के सिम्टम नहीं है, एडजस्टमेंट वाले सिम्टम नहीं है, it is just a worry, excessive worriness, what we call generalized anxiety disorder. 20-year-old female scared of elevator since birth. Elevator पे डर लग रहा है, prefers stair instead of elevator. और एक्रो क्या होता है? Heights. Social phobia means in society, so it is agoraphobia. A non-diabetic, non-hypertensive patient having some extra beat in pulse. Extra beat in pulse, doctor informed it is benign. अब मुझे बताओ क्या होती है पहले से? What are some extra benign beats? What it could be? It could be PAC, premature atrial contraction, or it could be premature ventricular contraction. PAC or PVC. But patient is still going for investigation from doctor to doctor. इनको बोलते हैं doctor shopper. What it is? It is hypochondria. 6-year-old child with no interest in daily activities and not engaging. To understand, autism preferred to be mute. The answer is autism. ADHD इसका उल्टा होगा, hyperactive. Drug of choice for OCD. OCD. What we give? Most preferred drug is fluvoxamine. Fluvoxamine is not given, so answer will be fluvoxamine. It is necessary. Okay? Goal-directed repetitive behavior. Goal-directed repetitive behavior means goal पूरे करने की repetition कर रहा है. That is seen where? In OCD. OCD. Psychological separation of mental function from rest of personality. क्या हो गया? Psychological separation of mental function from rest of personality means we are deviated. तो उसको बोलते हैं dissociation. Dissociation के कुछ disorder होते हैं. So when we change our personality, we have three forms. One is called dissociative fugue. Dissociative fugue means there will be history of wandering away. Dissociation means अपनी personality change हो गई, मोक्ष के लिए कहीं चले गए, हिमालय पर चले गए, वहाँ रहना. Separated from society. Society से अलग कर लिया. Like many people, those who follow Buddhism, कुछ लोग संत बन जाते हैं एकदम से. Right? मेरे पास एक patient ऐसा pilot था. Pilot था with a good salary, but all of a sudden he preferred to follow Buddhism. Buddhism, Jainism follow करता था, 7 बजे सोना चालू कर दिया उसने. 7 o'clock. फिर कोई जैन है यहाँ पे? 7 बजे सोते हैं, ऐसे लिखा होता है वहाँ पे. 7 बजे के बाद कोई मील नहीं खाना, खाने में नमक नहीं देना. We started following that thing. Now understand, this can become severe. This can become sometimes severe. Sometimes it can become severe, and patient can have depression. and sometimes it become even more severe. Then there will be total change in personality. Then what we call this DID. Dance India dance नहीं है. It is dissociation identity disorder. ठीक है? So पहले क्या होगा? History of wandering away. Question समाज से दूर चले जाएगा, पहाड़ों में बस जाएगा या कहीं भी separated. Then there will be depression and ultimately there will be change in personality. We call this dissociation identity disorder. Let us see. Okay, what is Skinnerian conditioning? Understand? Pavlov ने जो experiment किया था, that was with the dog. Skinner ने experiment किया था, this was with rat. Pavlov की conditioning को बोलते हैं classical conditioning, and Skinner conditioning is called operant conditioning. You understand what Skinner did? एक चूहे को एक बॉक्स में बंद कर दिया. उसके बाद इस बॉक्स में दो स्विच लगा दिए. If this rat is hitting this blue switch, or this rat is hitting a red switch, अगर ये blue switch hit करेगा तो उसको food मिलेगा, और अगर red switch hit करेगा तो उसको electric shock मिलेगा. तो शुरू में तो ऐसा हो like in a state of anxiety, शुरू में तो rat was hitting alternate switch. एक दो बार झटके खाने के बाद ये देखा गया कि rat is sitting only and he is sitting in the corner. So that is called, if you want to improve the performance, either give some reward or give some punishment. So this was the Skinner experiment. इसको बोलते हैं operant conditioning. So Skinnerian conditioning is operant. Pavlov method is ये दोनों same. Pavlov और classical. 45-year-old man has presented to you with sexual indulgence and increased alcohol consumption. Irritability, decreased sleep from last 10 days. इसके feature लग रहे हैं. These are feature of mania. Hypersexuality, increased alcohol consumption, irritability, sleep, कम हो रही. Family members said that he was career-related, remained wide awake and prolonged period of activity without getting fatigue. So this is a classical feature. ये सारे classical features हैं, मैं एक बार highlight कर देता हूँ. First is hypersexuality. Second is drug consumption, irritable, lack of sleep, and less fatigue. So these are features of mania. Following is not a classical feature of mania. बताओ, mood बढ़ेगा, energy बढ़ेगी, judgment बढ़ेगा, concentrate नहीं कर पाएगा. Right? He cannot have good concentration because ये पागल है. Elevated mood. True about obsession. Obsession. Are they real? They are not real. So they are ego destroyer. OCD का treatment बताओ. Exposure and response. Bow inhibitor का यूज करते हैं. Bow inhibitor. Parkinson's disease. Example of bow inhibitor. Bow inhibitor. Serotonin, rasadilin, sublingual. Diazepam is sedative. And neurosurgery we do in some epilepsy, sometimes Parkinson. Phobia का treatment. Covert sensitization, psychotherapy, relaxation, behavioral therapy. Again, like it is not a complete MCQ. Relaxation therapy is a part of behavioral therapy. ये complete MCQ नहीं है. Relaxation therapy is a part of behavioral therapy. तो behavioral therapy का एक part है. Phobia के पेशेंट को डर लग रहा है तो आप उसको relax भी करोगे. Again, it's not a complete question. Missing MCQ. Following best explained behavioral therapy in phobia. ये तो मैंने बताया था. Phobia में क्या करोगे? Exposure and response prevention. It is done in OCD. Systemic desensitization followed by exposure and response. क्या करोगे बताओ? D or C? एक्सपोजर एंड रिस्पॉन्स प्रिवेंशन मींस आप एक्सपोज कर दो, रिस्पॉन्स को प्रिवेंट करो, फॉलोड बाय systemic desensitization. Right? The answer will be C. Good prognostic factor for bipolar disorder. Acute onset is good prognosis? Yes. Early age is not a good prognostic factor. Lithium का use करते हैं. Remember in BPD में अगर rapid cycler है, अगर rapid cyclers है, then you will not use lithium, then you will use valproate. BPD with rapid cyclers you will use valproate. Following is not used in therapy of bipolar affective disorder. Lithium carbonate is drug of choice. इधर use करते हैं, not use cushion. Valproate भी use करते हैं. Topiramate is anti-epileptic. Topiramate we also use. Phenytoin नहीं use करते. Topiramate को याद रखना. Topiramate was introduced as anti-epileptic drug, but इसका main use कहाँ होता है? It is used in BPD. और कहाँ पे होता है? It is used as an alcohol anti-craving drug. Anti-craving drug for alcohol. Sensitive person gets affected easily and has difficulty in controlling anger. Doesn't meet people. What is the type of personality? Personality कितने type की होती है? What are the clusters of personality? So we have cluster A, cluster B, cluster C. Cluster A में कैसे लोग आते हैं? Cluster B में? Cluster A में कौन-कौन से आते हैं? Schizoid, paranoid, schizotypal. Cluster B, borderline, histrionic, antisocial. Cluster C, obsessive compulsive type, avoidant type, and dependent type. Understand? इसको कैसे याद रखना? Cluster A, we call them wild type of person. These are worried. These are weird, and these are always worried. The wild, weird, worried. You understand? This worried means we will see avoidant, dependent. अब इसमें क्या पूछा हूँ? A sensitive person gets affected easily and has difficulty in controlling anger and doesn't meet people. So these are weird set of people. अब weird में कौन सा इसमें आ रहा है? Borderline. It's not mania. Mania तो personality भी नहीं होती. Anorexia nervosa is an eating disorder. मैंने बताया था वही क्वेश्चन आया. Except क्या नहीं होगा? Amenorrhea. What you will see? Amenorrhea. 20-year-old man was found in a city far away from his hometown, working in a factory. He was unable to tell about his previous life. Following is a likely diagnosis. History of wandering away. अभी बताया था मैंने. अपने घर से दूर चला गया. This is dissociative fugue. A 21-year-old girl is disturbed that her nose is too big. She is convinced that it's disturbing. No one else can see that. It is excessive thought about body shape because it's body dysmorphia. A lady washes her hand 40 times per day for no apparent reason. What you will do? Okay, so समझो एक बार. Desensitization means किसी को धीरे-धीरे desensitize करना. So that is again where we will use desensitization. Phobia. Thought stopping. क्या बताया था मैंने? Sensate focus. Thought को आप रोक दो. Premature ejaculation. Response prevention we use in OCD. आंसर तो ये हो गया एवर्जन थेरेपी. Understand what is the meaning of aversion therapy? A person is taking some drug to get calmness. For example, patient taking alcohol to get calmness. अगर आप डाइसल्फिराम दोगे तो डाइसल्फिराम के बाद क्या होगा? वो शराब देगा, उसको उल्टी हो जाएगी. So it's getting opposite effect. So that is called aversion therapy. So aversion therapy basically is nothing. We use disulfiram in alcohol addiction. आप पेशेंट को डाइसल्फिराम दोगे, जैसे ही वो डाइसल्फिराम लेगा उसके बाद शराब पिएगा, उसको उल्टी होगी, हेडेक होगा. So that therapy is called aversion therapy. Kleptomania, impulse control disorder. Dialectical behavioral therapy is used in क्या होता है? Dialectical behavioral therapy. Understand? It is a type of therapy where like we deal with the patient to deliver some mentorship to groom his personality. किसी की आपको personality change करनी है, so what therapy we use? Dialectical therapy. Modeling and shaping are part of this therapy. कि आप अपना रोल मॉडल बनाओ, उसकी personality change कराते हैं. Fear of being alone in crowded or fear of traveling alone in the bus. Agoraphobia. ये भी repeat हो गया. एक और इसमें. Okay, try to answer. A patient after getting operated for appendicitis developed confusion. Now see, अगर किसी क्वेश्चन में psychiatry के क्वेश्चन में confusion, altered sensorium दिया है, that is suggestive of delirium. And delirium is most common organic brain disorder. The most common psychiatric illness seen in medical surgical patient. Delirium. Most common organic mental disorder, again delirium. Clouding of consciousness. ये MCQ में hint होती है, very very important. Clinical case में भी hint आती है. Clouding of consciousness you will see where in delirium. The loss of consciousness means organic brain disorder, Rett syndrome or delirium. True about dementia. Dementia में memory impaired होती है. Yes. So dementia is memory loss plus some cognitive defect. Loss of consciousness नहीं होती है. Normal sleep cycle हो सकती है. Yes. Personality deteriorate हो जाती है. Later stages. Dementia pugilistica. We also call this punch drunk syndrome. Punch drunk syndrome. It is seen due to repeated head trauma. बार बार सर पे चोट लगती है, तो फ्लू लगती है, उससे क्या होगा? पंच ड्रग सिंड्रोम. अल्जाइमर में कौन सी दवाई नहीं देते? पिपेरिडेन होता है शायद. आई थिंक दिस इज DEN. पिपेरिडेन. तो दिस इज पिपेरिडेन. दोनों पेशेंट देते हैं. दोनों पेशेंट इज DOC. Second preferred drug is rivastigmine. Then what we have? Memantine. Piperidine is used in Parkinson's disease. Is it? It is not used in Alzheimer. It is used in Parkinson's. Reversible dementia. बताओ. Understand? इसको समझो, इसको रखना नहीं. If dementia is due to any neurodegenerative disease, that is irreversible. अगर dementia किसी की कमी से due to some deficiency, वो ठीक हो जाएगा. तो अगर थायराइड की डेफिशिएंसी है, थायराइड आप दोगे, ठीक हो जाएगा. वर्निक की एंसेफेलोपैथी अल्कोहलिक्स में होती है. थायमिन की डेफिशिएंसी, थायमिन दोगे, ठीक हो जाएगा. हेड ट्रॉमा, चोट लगेगी, थोड़े टाइम बाद ठीक हो जाएगा. अल्जाइमर इज इरिवर्सिबल. अल्जाइमर इज न्यूरोडिजेनरेटिव डिसीज. डिमेंशिया प्रेकोक्स, क्रेपलिन. लॉस ऑफ कॉन्शियसनेस, ऑर्गेनिक ब्रेन डिसऑर्डर और डिलीरियम. Dementia pugilistica, again same question. Pseudo dementia is seen in depression. Pseudo dementia you will see in depressed patient. कितने क्वेश्चन है टोटल? 140. Okay, after 72 hours of cessation of alcohol use, following is seen in patient with alcohol dependence. 70 to 48 hours. 48 to 72 hours के बाद क्या मिलता है? Delirium tremens. Delirium tremens. Seizures you will see in 24 to 48 hours. Earliest symptom. Chronic alcoholic patient develop delirium tremens after stopping alcohol. क्या दो डायल को बोला मैं टाइमिंग डायल को बोला मैं ओके ना सर chronic alcoholic है तो टाइमिंग दो गया 100 mg के इंजेक्शन आप then they can use lorazepam because this is delirium. Tachycardia, arrhythmia, scratch mark or skin. Most problems of skin. क्यों? Why? What's not different? उनको scratch के marks. Now see, alcohol will cause bradycardia, right? Cannabis can cause tachycardia, but cannabis will unlikely cause arrhythmia. Heroin, cocaine both can cause, but scratch mark you will see with cocaine. History of visual hallucination and disorientation. He was chronic alcoholic. Last intake was 2 days back. Hallucination are and disorientation. 2 days means 48 hours. Now see, what it can be schizophrenia. No. He was chronic alcoholic and last intake was 2 days back. Visual hallucination. It can be withdrawal seizures. Different means. क्या हो सकता है? Again, alcoholic hallucination कोई term नहीं है. There is no such term. So answer will be delirium. Antidote for methyl alcohol. Okay, आगे disulfiram is a type of aversion therapy. Okay, ये देखो ये trending topic है. They can ask you question. Anti-craving में we give naltrexone, ondansetron, topiramate, acamprosate. So these are the drugs: naltrexone, ondansetron, topiramate, acamprosate. In maintenance what we give? Benzodiazepine. Right? Benzodiazepine में भी कौन सी प्रेफर करते हैं? Chlordiazepine और lorazepam, oxazepam. 8 rape drug. Fluditrazepam. Grass, weed, pot, slime. ये तो पता ही होगा. Trip word. Trip का मतलब क्या होता है? Trip मतलब आप trip पे रोज जाते हैं. So we go occasional use with short abstinence. Means कभी-कभी आते हैं. Right? So trip word means it is single use for lifetime? No. Frequent use for short abstinence? No. So LSD कब लेता है इंसान? कभी-कभी whenever is going on a occasion. So it is like occasional use with long abstinence. Not short, long abstinence. Alcohol withdrawal present with all except hallucination होगा? Bradycardia? Withdrawal में क्या होगा? Tachycardia. Withdrawal में tachycardia. After cessation of drinking in a person dependent on alcohol, when does the risk of alcohol seizures? Seizures कब आते हैं? Now see, tremors ये दो rule out हो गए. Seizures will occur when in 1 to 2 days. 1 to 2 days means C और D में से एक आंसर होगा. क्या चूज करोगे? क्या आंसर होगा? C. 12 to 24 hours. Alcohol intoxication is based on which of the following? बताओ. Alcohol intoxication कैसे ठीक करोगे आप? Amount of breath order? No. Medical fitness? Age and sex? Severity of respiratory? and CNS depression. Not a form of cannabis. भांग तो cannabis से बनती है. चरस cannabis की stem से बनती है. Right? Female buds से गांजा बनता है. पत्तियों से दीप से क्या बनती है? भांग. Cocaine is a separate. It's an opioid. It's not cannabis. It is opioid. Early and rapid addiction is seen with smoking. Bad trip, LSD. IQ range of severe mental retardation. Now, this is severe. This is Moderate, ये क्या होगा फिर? Profound. आंसर क्या होगा? 20%. ये जी क्वेश्चन है. Cut down, annoyed, guilt, eye-opening break. What we call cage question. Bad trip, LSD. Opioid withdrawal का symptom. Withdrawal में क्या होगा? Pupillary constriction होगा, dilation होता है. Hypertension होता है. Piloerection will be a symptom. A 13-year-old boy was brought to child psychiatrist for misbehaving frequently at home in school with teacher. Often bullies the younger kids and has been stealing money. So violent behavior आ गया. It's a case of conduct disorder. Child with IQ appropriate to his age and normal learning skill. In poor in mathematics and getting poor marks.
Specific learning disorders.
It is specific learning problem. Moderate. Moderate देखो भी ऊपर लिखा 35 to 49. What is Rett syndrome? It is an X-linked recessive condition, more seen in females. Right? So death कैसे होती है इसमें because of respiratory failure. X-linked dominance. 50 to 60. क्या होगा 50? And more than 70 is considered normal. Is it? Okay. So just try to understand this. Just remember, sometimes they can ask you some stages. Dabda. Dabda means denial, anger, bargain, इसे क्या है? Depression, acceptance. These are stages of grief, and these are given by Kaplan notes. Right? So with this, we'll conclude